This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Hey, good morning. Welcome into the program. Dave Wilson and Sarah Giosi with you. Good morning, Sarah.
Good morning.
How you doing over there?
Hey, pretty good. Can't complain.
Got a special guest in studio with us this morning. It is the new president and CEO of Mon Health, David Goldberg, who joins us on the program. Good morning, David.
Good morning. How are you?
Doing fine. You ready for Thanksgiving?
I am very ready. Can't wait for my turkey.
Bird is marinating?
I'll ask my mother-in-law that after we get out.
At the very least, it's out of the freezer.
Okay.
That's what matters.
So you're not cooking the Thanksgiving dinner. You just show up to eat.
Yeah, you don't want
All
me
right.
cooking.
We're on the same page there. We're on the same page. Well, thank you for taking some time to join us here this morning. As I mentioned, you're the new CEO and president at Mon Health.
Yeah.
Give us a little background. Where do you come from? Who is David Goldberg, I guess is the question.
It depends if you ask me or my family. I've been here almost a little short of 2 months. Came from Pittsburgh before that. I was with Allegheny Health Network, where I was an executive vice president and a senior vice president before coming here. Ran hospital operations, administrative services, and then AHN is owned by Highmark Health, so I did a lot of post-acute work on the insurance side. But I've been in healthcare almost 20 years.
What got you started?
I'm a former pediatric patient. I was a Shriners kid when I was 7 years old, and I have always loved healthcare. I remember being treated the best by the nurses and doctors in Philadelphia at Shriners, and always wanted to be in healthcare. And here I am years later, starting as a fundraiser and then working my way up through operations, getting my master's degree while working, and then got the bug of operations and been doing it ever since.
So before you were in Pittsburgh, talk to us a little bit. Let's go deeper history. Yeah. Tell us a little bit more about those deep roots.
So, like I said, my big issue is always about patient care. Being a pediatric patient myself, from age 7, I had a tumor in my upper spine, and it was removed when I was very young. Never thought I'd get into healthcare. I worked on Capitol Hill after graduating WVU. I was a political science major, so I bleed blue and gold, and worked on the Hill, and then got into healthcare through fundraising, and then got the bug about operations working with nursing. Loved seeing patient care at, front and center of what we do is taking care of our communities, and I have always found it a calling. And here I am years later now involved in healthcare operations, from community activism, developing programs, but partnering with the clinicians to make sure that the tools that they need to deliver the excellence in patient care is ready for them. And then we balance the economics with it to make sure we can afford what we do, but it's always about what the community needs.
Has that given you a little bit of a different perspective on patient care and patient needs? Being a pediatric patient, that perspective that you bring to this job, I would venture to say a lot of people don't have that viewpoint who sit in the chair that you sit in.
I would hope so. I mean, at the end of the day, we don't produce widgets. We deliver patient care. So being a former patient, and all of us have experienced healthcare, whether it be in the physician office or in the cath lab or in the operating room or, heaven forbid, the emergency room, it's about making sure that you keep the patient in the center of what you do and then drive the care out that way, and that's exactly where I've been focused for my career. Plus, the dad of 2 daughters, I want to make sure anything that I am a part of, heaven forbid my family needs the care, that I'm proud of it, I stand behind it, and can deliver it to my family.
Again, we're speaking with David Goldberg, new president and CEO of Mon Health System. So you've been here now 45-ish days? Working.
Yeah.
Okay. And how are you settling in? How have you taken in first impressions of Mon Health Systems?
Well, first, I love being back in Morgantown. I mean, I've been coming back and forth for years for football games and sporting events. I've served on committees at the university through arts and sciences and other. So I'm glad to be here. There's a lot that's the same and a lot that's different. I'll start with what's different. The advancement of healthcare since I was here in the 90s to today is just superb. I applaud not only Mon Health, but WVU Medicine and all the providers in and around the community for delivering top-in-class care and access across. And I'm thrilled to be part of the next chapter of where Mon Health is going to go. Our job is to focus on what the community needs with our 2 hospitals, Preston Memorial and Stonewall Jackson hospitals. As part of us, over 100 employed physicians here in Morgantown with another couple dozen in our other hospitals and communities. partnering with those communities to deliver the care and make sure patients get to where they need to go for the excellence. Mon Health is poised for it, and I'm thrilled to be a part of where we're going into the future.
We're visiting with David Goldberg, new CEO and president of Mon Health. We'll talk about the future, the vision for Mon Health, and the partnerships or the relationships with other medical care providers here in Monongalia County as well. Stay tuned. More of that coming up next as we talk to David Goldberg, CEO and president of Mon Health.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
David Goldberg, CEO and president of Mon Health, joining us here in studio this morning. As already confirmed, he does not cook Thanksgiving dinner. He only eats it. Man after my own heart there. Hey, David.
John Howard Subaru.
David, we are lucky here in Monongalia County that we have Mon Health and we have WVU Medicine there as well. What's the relationship between these two organizations? Or how do you see the relationship between these two organizations?
First of all, I think collaboration is the most important thing we can do in the community. I mean, both of us have our purposes and our vision and mission in the community. I mean, WVU, again, is an academic tertiary quaternary training center, excellent care. We at Mon Health Medical Center, and our other hospitals provide community-based care. So both of us need to be here. Both of us provide excellent services. And my job is to make sure the collaboration continues to go forward and that we find opportunities to provide the care that the locality needs, let alone what the patient needs close to home. No one should have to leave Morgantown for advanced care.
So how can you two work together? Do you work together?
Oh, absolutely. I think the dialogue is getting much better. I've had multiple conversations with the leadership there. I just had lunch Friday with many of the physician leaders at WVU Medicine, and we talked about where can we collaborate. We currently contract for some services through WVU Medicine. Neurology is something we're talking about, but definitely pediatrics, nephrology, other types of services, and there's a lot we can be doing together, and we have a long history of it. And my job now is to continue the dialogue to make sure that patients, when they present at Mon Health or present at WVU Medicine, that they stay here. I may have been in Pittsburgh previously, but I don't want to send people to Pittsburgh or Cleveland or Washington, D.C. for advanced care when we have the best specialists in the nation right here in Morgantown, and people should be staying here for that level of care.
I'm going to switch gears just a little bit now and start to talk about some of the headlines that we've been seeing recently. Obviously, there's been some news related to Mon Health. And as someone that's from the community, I think that it's maybe made some people nervous about what the future of Mon Health is. Now, as the new person coming in that's kind of giving a fresh look to all of this, what do you have to say about that?
Well, first, I would say the future is very bright. I wouldn't have left a great job in a great community if I did not believe in my heart of hearts that Mon Health will continue to thrive. It will, and it is. For the month of October, all three of our hospitals were profitable. And I say that only to show we're producing what's called revenue over expense. We're able to afford to make the investments in the future of healthcare through acquisitions of physician practices, opening up different locations around the community. Stonewall joined us a little over a year ago. So anytime we make an investment, it takes time to realize those investments. That being said, the future's bright. The volumes are up significantly, and while, working for an insurance company in the past, you don't judge it all by the volume of, heads in a bed. But our ERs are busy, our operating rooms are busy. We have lots of patients using our services. EMS calls are up, unfortunately, but we're ready for them. Timely care, when a patient presents to our emergency room, they're direct bedded to see a provider. That doesn't happen by accident. So you could feel the difference when you walk through our facilities, and I'm thrilled to see the trajectory going forward.
What was the message to your physicians, to your staff when you took over about you and how you wanted to move this organization forward?
Well, first, I'm a clinician-led type of person. I think it's important to have the nurse or the phlebotomist or the physician or physical therapist at the table making the decision, where do we build the programs? How do you invest the dollars to be able to build the programs, and make sure the patient is in the center of everything we do, with everything else will follow it. Money will follow quality and service. We just got Leapfrog A-rated for both Stonewall and Mont Health Medical Center hospitals. We have some of the best quality metrics in the country. Our patient experience is top decile, top quartile. That doesn't happen by accident. So focus on what the patient needs, deliver it in an excellent way with compassion, and we're going to be fine, and we're going to continue to thrive.
We'll continue the conversation with David Goldberg, CEO and president of Mon Health, when Mon Health Talk continues right here on the Voice of Morgantown, 104.5 FM and AM 1440 WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now 304-296-0041.
Dave Wilson and Sarah Giosi. We are speaking with David Goldberg, CEO and president of Mon Health. As we were discussing there the future of Mon Health and where you want to see this go, one of the questions a lot of folks here in the area have are, what is the dedication to community health? Because there's a lot of folks who use the clinics. We had a question in from a listener whose father uses the Fellowsville Clinic out in Preston County. What's the dedication toward keeping these rural areas open and embracing community health?
Yeah. I believe healthcare organizations, Mon Health in particular, you have to bring healthcare to the communities where the people are. I think it's important to get things, as many services off a hospital campus as close as you can, especially with primary care, working your way primary care up. We opened up a brand new multi-million-dollar center in Elkins where we're expanding cardiac care as an example, because that's what the patients need close to home. So I think it's important, and we're not backing away from our commitment for access.
What have you been impressed with? I mean, you've been here, 45 days-ish. Yeah. What's impressed you so far?
The people. These are some of the best doctors that I've worked with, and I've been in Virginia, I've been in Pennsylvania, I've been in Texas. These are some of the best, most caring healthcare leaders I have ever had the privilege of working with, from the doctor to the phlebotomist to the registrar. And I have to tell you, the volunteers. There isn't a day that I don't walk through a hospital that people aren't making eye contact, smiling, leading our patients or our families from point A to point B. And if we have a minute, what sold me to come here, when I first was interviewing, I came to the hospital under the dark of day without my tie on, and I saw a nurse wheeling a new mom and father with baby out to their car. And when I saw that nurse saying, I know what you're thinking. These are the 5 things that you're thinking about as I'm taking you to your car. That doesn't happen by accident. That's Mon.
So you did a little undercover boss.
Yeah.
Showed up, huh?
Oh, yeah. I've done ride-alongs with EMS where I have my jeans on. I don't shave for the day because I want to see what's happening around the community. And, from EMS, all the agencies that support EMS, not just Mon Health EMS, but Health Team, and the other municipalities, we have excellent caregivers in this community. It's very important for people to know. You don't have to leave the greater area for the care you need.
On the flip side, as someone coming in with some first impressions, what are some areas that you're excited to grow here as well?
I think one is to make people comfortable and understand that the services that Mon Health provide are excellent and expert, and there's choice. The other is cardiac care, neurological care, nephrology care, GI care are some areas that we can collaborate with the university, but also make sure that care is accessible when people need it rather than having to leave for it.
Talking to David Goldberg here on Mon Health Talk. He's the CEO and president of Mon Health. As you look over West Virginia as a whole, we have our share of healthcare issues, no doubt, in West Virginia. How can Mon Health be a player and an active participant in trying to tackle some of our we have obesity, we have heart issues, we have diabetes issues here in West Virginia. How can Mon Health be a player in tackling statewide issues from here in Morgantown?
Well, one, the president of Stonewall Jackson Memorial Hospital, Ava Stolnacker, is the president, or the chairman of the West Virginia Hospital Association. So we're at the table in conversations at state level and federal levels related to healthcare. I was meeting with our Heart and Vascular Center leaders today, Dr. Warden and others, and they share with me any patient at Mon Health Medical Center who has any kind of symptom of cardiac care gets rounded on by a cardiac provider. They may not be in for it. They could have pneumonia. They could be in for orthopedics. But if they believe they have arrhythmia or high blood pressure, we're rounding on them there to make sure they get access to care, because we take the patient in the center and we bring care around them. So I think those kinds of conversations are important. Lastly, we all talk about the drug addiction and opioid issues hitting our state. We have to be part of it and make sure that the treatment is taken into the light rather than the shadows, and that we make sure we're front and center and provide our patients with access to rehabilitation, make sure they have access to best-in-class care, and that we can help them through their situation, whether it be addiction or rehabilitation or any other issue affecting them in home.
Talking to David Goldberg, CEO and president of Mon Health. I don't want to say you're new to town because you've been here before. What surprised you most about the time you left Morgantown by the time you got back?
Oh, the traffic is still awful.
So that didn't change.
That did not, and I'm glad to finally see the national news is finally recognizing West Virginia for the pepperoni roll. I saw that over the weekend on CBS.
Yeah.
And I've gotten lots of people say, please bring me the pepperoni roll when you come back to visit family in Virginia, Pennsylvania, or when I go to Texas. What is excellent is to see how the town has really, I'd say, grown in a sophistication area. My home I lived in when I was an undergrad is gone. I think they tore it down like 5 days after I left. And now all these beautiful college homes are there. It really is incredible. And I'll add, to have 3 awesome ladies that are going to be potentially Rhodes Scholars, 2 of which are athletes. I mean, that just blows me away, the caliber we continue to recruit through the university and then grow through Morgantown.
You mentioned you've been on some ride-alongs. Have you had a chance to kind of drive around, get your bearings again geographically here in the greater Morgantown? I say the greater Morgantown area.
Oh, I've been down to Stonewall in between. I've been out to Preston. I'm going there again later today to have some meetings. I'm getting my bearings straight, and I love GPS. Thankfully, I have that now versus when I was an undergrad. I barely knew where I was going. The roads, to me, the improvements that are coming in the infrastructure have really made access much easier. But to your question a moment ago, that's why we have to bring healthcare out to the community so they don't have to all come to Morgantown for the level of care. The hub and spoke model that most providers are doing today is important. We need to make sure that we're on the cutting edge as well.
Well, we're working on the roads. I think because they knew you were coming, we passed that road bond, and we're going to make some new things happen.
No, and it's excellent. I when I did my ride along with EMS, we had a poor lady. They were trying to do an I think to give an IV to start it before she went to the ER, and the EMS were saying, listen, we're going to drive as carefully as we can, but there's a couple potholes along the way. But I'll tell you, they did not skip a beat, putting the needle in. One stick, got the IV in. I mean, that goes to show how great our providers are.
Well, and that's important. That's the kind of stuff we don't think about. And you mentioned something earlier whenever you were talking about, I think it's really comes down to communication. Whenever you have a patient, but you can have people from different areas coming to check on them.
Absolutely.
It's just so important. And a lot of these are things perhaps we take for granted, but I think is something that's very special about Mon Health.
Well, Mon Health is patient-centered. I mean, if the patient needs something, we're going to do it. We do discharge phone calls on our patients. We make sure we follow up with their care. We make sure if they're a patient of ours that isn't, their doctor isn't part of our employed network, we get discharge summaries back out quickly so that referring doctor knows what happened, can see what was done, and more importantly, not repeat a test that may not need to be repeated, but be able to act upon what was done while in the hospital, in the emergency room, or in the clinic. So we're real excited about that, and we just have to continue to dialogue with the community and identify what do you need, where do you need it, and how do we provide it more timely.
Tell you a quick story before we go. We got about a minute, but the thing that makes communities, something like Mon Health, special, my uncle had open heart surgery at Mon Health. Didn't know he was going to have it, kind of tripped into it actually, but turns out his surgeon was a baseball player that he had coached in high school. So immediately you have a relationship there you don't get if you go to Pittsburgh or Cleveland or Baltimore. So that's that kind of community health aspect that I'm sure you're going to hear a lot more of those stories down the road.
Well, if I can add real quick, one of the things I'm most proud of, over the last year, we have done outreach programs that we have seen 8,000 patients through 47 clinics. We don't, take it for granted, and we'll make sure where the patients are, we go.
Welcome to Morgantown.
Thank you.
And good luck. The news is next.